Then we see the pharma marketing machine sends drop dead gorgeous pharma reps to doctors' offices who flirt, who make them feel special. They're taken out for steak dinners. They're given bonuses for, prescription behaviors, which can and absolutely do influence their behavior, the way that they are scripting out these drugs. Hello, my friends. Welcome back to another episode of Better with Dr. Stephanie. 'Tis me, your host, as always, Dr. Stephanie Estima. And we are doing an AMA, an Ask Me Anything today. And if you're watching this on YouTube, you'll have to pardon my lack of makeup. There's just lip gloss on today, but I feel like we're friends, and it's about that time. So I am answering all of your questions. I polled you on Instagram. Lots of questions coming in. First, all about my recent wedding. So the diet and the training. There were some pretty intimate questions in here. So I'm gonna go over those with you. We're gonna talk about HRT. We're gonna talk about creatine, Ozempic, estrogen, signs of perimenopause, symptoms of the 4 phases of perimenopause. Do I still intermittent fast? What do I think about seed cycling and all the like? So let's tuck in, shall we? So for some of you, maybe you didn't know, but I just recently tied the knot with the love of my life, Giovanni. We just tied the knot earlier this month in June. And by the time you're hearing this will be sort of towards the end of June, early July. And we had just a beautiful wedding. It was the wedding of my dreams, marrying the man of my dreams. So it was really lovely. And of course, lots of questions coming in about the diet and the leading up to it. So tell me what was your diet leading up to the wedding? And I'll start off by saying I'm going to disappoint you, but it wasn't really that different than how I sort of always eat. So I love to eat protein and carbs in that peri-exercise window. So if I have a little bit more flexibility in the morning, it'll be before I exercise. Most days when I'm working out at 5 or 5:30, sometimes I have started putting in a little scoop of protein powder and some collagen in my water on my way to the gym. That doesn't seem to feel like the brick in my stomach, so I can tolerate that. But protein and carbs kind of either right before, certainly right after. Always looking to take in some proteins and some carbohydrates at post-workout. I am going to admit that in the last month or so, my vegetables, I have been a baddie. So haven't been spending the time sort of luxuriating and savoring my kitchen as I normally do. So most of my vegetables have been coming from AG1, which is a supplement that you may have heard me talk about on the show before, but it's basically an all-in-one kind of supplement that has your probiotics and it's basically, for me, it replaces all the vegetables that I wasn't getting in the last month. So a little bit more reliance on a supplement before getting all my veggies in. And my protein sources are, typically eggs in the morning with some avocados, maybe some sourdough bread. That's kind of my favorite breakfast ever. Lunch, more of the same. It's like either chicken or ground beef. I do have this amazing chuck roast recipe that I just kind of salt and pepper the chuck roast, pop it in the oven, 375 for 4 hours. And then you take it out and it melts in your mouth. It's absolutely delicious. So I'll put maybe some rice or some sweet potatoes or something like that with it. Dinner's more the same. And then I have been getting in touch with my inner protein shake. So making sure that I'm keeping my protein high, partially because of the high volume of training that I consistently do, and looking for the protein to help with recovery. So currently I'm not calorie counting, and I didn't calorie count leading up to the wedding. But if I had to guess, probably, every day I'm probably eating something like 150 to 180 grams of protein every day. Part of that is from getting in touch with my inner protein shake. So, you can get probably easily 30 grams of protein from, a regular portion size of your chicken or your ground beef or whatever it is. But the, one scoop of protein is going to give you 25. So I will do 1 or 2 scoops of that once or twice a day. And then you can pair it. You can make it into like a little bit of a dessert, which I like to do as well. And then the other part of my diet that I did make sure happened coming up to the wedding, because I knew that I wasn't going to be able to drink a lot of water on the day of, because good Lord, getting in and out of that dress, like I had to go to the bathroom and I had to have my sister-in-law come into the bathroom with me, lift up my dress, help me take off my underwear and go to the bathroom. So any ladies who have ever been married and you had sort of the big dress, I didn't have like a big poofy dress, but it was just very long. She had to sort of hold up the entire dress. And I was like, God, I am so sorry. So I just had to pee. But anyway, leading up to the wedding, drinking at least a gallon of water a day. I really wanted my skin to be hydrated. I wanted to, of course, when you're drinking, you can often distinguish between actual hunger and when you're thirsty, because those things often feel the same. So lots of water leading up to the wedding. The day of the wedding, good grief, I think I had 4 sips of water the entire day, because I had to, before I got the wedding dress on, I was drinking and kind of voiding and whatever. And then once I got the dress on, I was like, okay, I'm not having another sip of water, because having to pee in this thing is going to be really uncomfortable. And as I just described, my poor sister-in-law to help me go to the bathroom in it. So that was my kind of diet. The training stayed pretty much the same. So currently I'm training with weights. I train 5 days a week, sometimes 6, but it's usually 5 days, and that's 3 upper, 2 lower. And then the other 2 days are cardio. And so the training has pretty much remained the same, volume and weights. If I'm in a calorie deficit, I usually find that I can't punch out the same weights, and I've been making some really awesome progress in my squats and my deadlifts. So there wasn't really calorie cutting or anything there. So that's training and diet. Shapewear. Now, y'all, we really must be friends for you guys to ask me this question. But one of the questions that came in was, what kind of shapewear did you wear on the day? And I didn't wear any. But I will say, so I didn't wear any shapewear, like no Spanx or anything like that. I didn't even though I wanted to, but I didn't even wear those, I call them chicken fillets, like those little boob things that you sort of put into your bra to sort of, make you a little bit more voluminous, let's say, like it gives you a bit more cleavage. I am the president and founder of the Itty Bitty Titty Committee. So I am, very kind of small up top, if you will. So I bought those little chicken fillets to put in my dress, but I didn't end up wearing them, because when I put the dress on with those chicken fillets, we were going to have a Janet Jackson moment. Like there wasn't any room for them. And I was kind of like, the little cup, like the little area for my breasts to go were already pretty small. So I ended up wearing a thong and a bra. And I can't believe I just told you that. So now we're besties. All right, moving on. So the only other thing, actually, there was a question here around dieting down for the wedding, or am I like this year round? The only alteration I'll say leading up to the wedding was that my husband, I guess I can officially say that now, my husband, Giovanni, and I ran a mastermind, because we're crazy, by the way, but we ran a mastermind the 3 days prior to the wedding. So the wedding was sort of the icing on the cake, following the mastermind. So my eating patterns for those 3 days were almost entirely thrown off. So I normally like to work out in the morning, and then I eat, and then I'm eating again, and then I'm eating again. So because of we'll say the frenetic and the busy nature of running an event, a 3-day event, my eating patterns were probably entirely thrown off. I probably ate less than I normally would have. Although I don't know if that made a huge difference in how I looked or my weight. I don't really, at least for me, I don't really make any measurable progress in 3 days. Like it needs to be, weeks and weeks of kind of doing the same thing before you see anything measurable change there. I am doing a boudoir. So now we're really getting intimate. So I'm doing a boudoir shoot next week at the time of this recording. So I am trying to think a little bit about my food, because I feel like in some ways a wedding dress can kind of cover all manner of sins, but I'm going to be basically in my knickers and my bra. So I'm trying to think a little bit about my food, but I did have wedding cake for 3 days after the wedding. So yeah, we'll see how that turns out. So a little bit of a disrupted eating pattern, maybe the couple days before the wedding, but nothing really, substantially or marginally different. Another question, I really like this question. It was, how do you have fun when you are so disciplined? And I want to tell you a story about how I used to not be really fun and not really have the ability to be fun or to have fun. And it was a couple of years ago now, I hired a coach. And this was a coach who was supposed to help me get in touch with my feminine side. I've recognized for many years that I am very much a type A personality, very driven, all the accolades, all the success, all of those things that really give me that dopaminergic rush when I achieve something. And like many type A personalities, probably maybe a little pathologized, like maybe more to the extreme, to the point where my softness, there was a point where I recognized, I was like, I can't remember the last time that I cried. Like it had been years that I had just allowed for that release. And I had always felt sort of on edge and guarded. So I hired this coach. God bless this woman. Let me just say. So after a couple of sessions with her, she probably, in all of her wisdom, now I'm looking at this in hindsight, hindsight's always 2020, but at the time, she said, what I think is going to be really helpful for you is if you take a piece. So in between our calls, so we'll meet next week, but in between our calls, like at some point this week, what I want you to do is I want you to take a piece of chocolate from your favorite chocolate, that you like to eat. And I want you to just take a square and let it melt in your mouth and just savor it. And, you can come back next week with any observations and any thoughts that you have around this exercise. Well, let me tell you, ladies, that I was so angry and furious that she had given me this ridiculous and inefficient exercise. Like what in my state at the time, I was like, what the hell is this have to do about anything? Why do I need to inefficiently just sit there while the damn chocolate melts in my mouth? Why can't I just chew it and get on with it, right? So what do? I fire her. I'm like, you know what? I don't think that this is the right fit. This is why I say, Lord bless this woman for putting up with my crap, because, later on, of course, only to realize that it's her, in her brilliance, she's given me a very easy exercise to demonstrate why it's important to slow down, how to be present, how to attune into your senses. And meanwhile, I'm giving myself a lobotomy with how hard I'm rolling my eyes at her. I'm thinking, what the hell am I paying for? This is such a stupid exercise. Why am I going to, I'm paying you so that I can go and get chocolate and eat a chocolate square slowly, get out of here. Anyway, so I share that story with you in vulnerability in a way, but also because it is a learned skill for someone like me to be able to savor the bliss and to be able to hold on to it. So am I the person that can just leisurely sit with chocolate and let it melt in her mouth effortlessly with grace and ease now? No, but I am orders of magnitude better than I was when I had hired that coach. So I have really leaned into the idea of, yes, I can be very driven and I can be very successful by working hard and being proud of my work. And I will also really slow down. So some of the things that I do right now, to answer your question, how do you have fun when you're so disciplined? I usually stop working at about 3:00 every day. And that coincides with when my children are done school, and I will basically get soccer balls kicked at my head for a couple hours, or we'll go play basketball, or, help them with their homework. That for me is a lot of fun, to be able to spend time with my boys. And, even in this sort of post-wedding blissful time, for me, it's the little moments that I have with Giovanni. So, we're having really a lot of fun just saying husband and wife to each other, wow, hi husband, hi wifey. So we're having a lot of pleasure and a lot of joy out of, being officially married now. And I was telling this to a friend earlier this week, and I'll share with you as well. My feelings for him have changed. It's so, I mean, I don't know if anyone else can relate to this. I mean, I've been with Giovanni now for, gosh, maybe 6, 7, maybe even longer maybe 7 years at this point. And, have known, you in 7 years, you see the good, you see the bad, you see all the things, right? And my love for him inexplicably, or maybe explicably, has changed. It's deeper. In some ways, I feel more committed to him than I ever have. And there's something about writing your own vows, saying it in front of people that you love, having a communal ceremony in a way, and having people witness that feels really good. So I have fun kind of every day. I like to think that it's open mic night all the time. And in my head, I'm hilarious. So I do try to have fun. It doesn't always work, but I do try to have fun and also be disciplined. So I think that kind of the bottom line, at least for me, is that you can be many things at once. So you can be a fun person and you can be disciplined. You can be a mother and you can be sexy. You can be confident and sometimes not feel sure of yourself. Like there's a continuum for everything. And then it's just really a matter of oscillating along that spectrum regularly. So that's maybe how I would answer it. Maybe there's a little bit of philosophy in there or life lessons, but I hope that it inspires you to figure out how you can maybe be more fun or take more pleasure in your life, in a life that's probably very disciplined anyway. A couple questions here about if I am on hormonal replacement therapy. The answer is no, but I'm certainly not against it. I do know it to be a lifesaver for many women. So I would say that in the order of when I'm thinking about what's now, what's next, certainly understanding your labs. So if you are considering HRT, first you want to consider your age, right? So how old are you? Are you sort of in that drop zone? Many women really benefit from bioidentical hormone replacement therapy and synthetic hormonal replacement therapy before the onset of menopause, like before the actual menopausal diagnosis is levied. And that is usually because there is some symptom that the woman is dealing with. So I am not on HRT yet. My progesterone levels are beautiful still. They're starting to drop a little bit, but still within what I would consider normal. And I would, when I do start BHRT, because that would be my order of operations, is like first get the lab test, figure out where you are. Are you in an optimal range? If you're not, what is the next step? For me, it would be BHRT. It wouldn't be HRT. So it would be bioidenticals first, and more than likely, it would be progesterone before I would be taking any estrogens. Estrogens usually are still pretty consistently higher into the late 40s and 50s for some women. It sort of depends on a variety of factors, stress and genetics and that kind of thing. But usually for most women, progesterone is the entry point for hormone replacement therapy, whether bioidentical or synthetic progestin. And because this question will probably, maybe it's ruminating, maybe you're already thinking it. The goal for taking BHRT is not to be fertile, right? The goal of the bioidentical or the HRT, we'll just call it HRT, but when I say that, I'm referring to sort of both types, whether it's synthetic or bioidentical. It's not to be fertile. Like we don't want fertile 60-year-olds, right? I think that there's a lot of conversation in the functional medicine community around, well, do we want to be extending the menstrual cycle well beyond, the natural stopping of it at about, the average age is like 51, 52-ish. And I don't think that we want fertile 65-year-olds. I don't think that that's going to be productive. Like if you're going to have a child at 60, by the time your baby is, if you do get pregnant at 60 and you deliver that baby when you're 61, or 61-ish, let's say, depending on when your birthday is, by the time that baby's 20, you're going to be 81. That's, I don't know. I don't think that having a fertile 60-year-old is the goal. I think that it is to supplement waning hormones and to alleviate symptoms. So You also want to be working with someone who can play around with dosages and who's going to be testing you before and after, right? You want to be looking at, where's my baseline? Let's say progesterone in this case. What's the baseline level of progesterone? Should I take this for 4 to 6 months? And then we can kind of reevaluate both the symptomatic, like the lived experience of the woman, but then also get some objective data and take some blood work and kind of take a look at and see what her progesterone levels are like as well. So that's sort of my little spiel. I'm not on it yet is probably the best way to answer it, but I'm not opposed to it. And when it's time for me to be on progesterone, you bet your ass that you bet your candy little ass that I'm going to be on it, because certainly some of the symptoms, and I would say that it would be also for me, in my decision tree, it would also be, is this trying to alleviate something? So am I starting to see shorter cycles? Am I starting to see POI? So ovarian insufficiency, which can happen for women in their 40s. Am I starting to look like I'm estrogen dominant, which I know that I can run if I don't keep my stress in check and my diet's off and my training's off and all that kind of stuff. So that would also be another sort of branch or arm of my decision-making tree, is what are the I'm taking this, but what are the symptoms that I'm trying to correct? Because once you start on hormonal replacement therapy, you're sort of, you're tethered, right? Like you're sort of in there for the next little bit, because now you are taking exogenous hormones, which is going to sort of further downregulate your own endogenous production of it, right? So I'll kind of leave that there. A lot of questions about creatine. Do I take it daily? Do I cycle it? You know that I'm the cyclical lady. I like to look at life in general through the lens of cycles. With creatine, I typically supplement with it daily when I train. So, I will, as I mentioned, I'm training probably about 5 days a week now. It's pretty consistently 5 days a week. Sometimes it's 6, but most times it's 5. And then the other 2 fill days, we'll say, are like active rest days. Like I'm doing some cardio to work my cardiopulmonary system, my VO2 max, that kind of stuff. What ends up happening for me is that I do cycle it. I usually will be on it, and then I'll be on it for maybe 1 or 2 cycles. And I'll do it consistently 5 days a week. And then I'm usually off for a week. And there's no particular reason for this other than my own ineptitude, which means I've run out of the jug that it comes in. I've run out of the creatine. Then I have to remember to order it, which takes me like a couple of training days to remember, like, oh, okay, when I'm making my protein shake, I don't have the creatine to add in there. And then I got to remember to get on Amazon and then deliver, blah, blah, blah. So that usually takes about a week. So I'm probably on it for about 2 months consistently, like 5 days a week. And then I take about a week off because I'm not organized enough to do ship and save or whatever the thing is on subscribe and save on Amazon. And just because I love words, creatine is named after the Greek word for meat. So kreas is, for all my Greek listeners, you'll know what I'm saying here. So the Greek word for meat is kreas. And so creatine was first isolated in skeletal tissue, and the founder, or the person who discovered it, named it creatine because it was found in skeletal muscle. And for those of you that don't know what I'm even talking about, like what is creatine, should I be taking it, et cetera, it's basically it's not a protein, but it is the primary, maybe the best way to say it is the primary constituent of phosphocreatine, which is a system that is used to regenerate or to create ATP within the cell. So probably, I'd say 95 to, we'll call it 95 to 97% of the humans, of our total creatine is found in skeletal muscle, right? The remainder is going to be sprinkled in the blood, the brain, other tissues, but primarily it's in the muscle. And you're going to degrade probably, 1 to 2% of intramuscular creatine per day. Okay. So you'll hear people ask, like, what is the supplement? Like, why should I be supplementing? How often should I supplement? Do I load and deload? So typically, if you're someone who is active, so you're working out about an hour a day, you're going to degrade about 1 to 2% of that intramuscular creatine. So you're going to need somewhere between 3 and 5 grams per day to maintain that average creatine storage. So if you're someone who eats meat, kreas, if you remember the word, Greek word for meat, kreas, creatine. If you're someone who eats a combination of meat and, let's say, plants, like an omnivore, meat is a very rich source of creatine. We are usually eating, right? We're eating the muscle, right? When we're eating meat, typically, unless if you're a carnivore or you're super fancy and you're having the organs as well, most of us eat the muscle. Like when we have steaks and when we have chicken breasts, and these are that's the pecs, like the chicken breast that we're eating is the peck of the chicken. So if you have an omnivorous diet, roughly half of your daily requirement, like roughly half of that 3 to 5 grams of creatine, you're going to get from your diet. The remainder can be resynthesized, right? The liver, kidneys, and stuff. I typically, when I'm supplementing, I take 5 grams because I usually miss 2 days. So I'm trying to make up for it. And the way that you might load the cell, and the way that I've done it one of 2 ways. One is if I'm pretty patient or just unorganized, which I often am, is just 5 grams a day for about a month. And that is going to be enough to saturate the myocyte so that the total muscle creatine storage is going to be saturated after about a month or about 1 menstrual cycle. You can also load in a week. So you can also take like 20 grams a day for, 6 or 7 days. That will also saturate the muscle. And just keep in mind that if you do it the longer way, which is usually how I do it, if I'm being honest, you have to wait the entire month of the supplementation in order to reap some of the benefits that creatine is going to have. In your performance, in your mental cognition, in your in brain fog, in your explosive power, and just on the cellular level, your body's ability to generate energy during activities like resistance training, burst training, etc. So depends on how patient you are. I'm a pretty patient person. I like to play the long game, so I will usually. What I do is I take, as I've mentioned, creatine 5 grams. Daily when I train. And that way I'm sort of covering my bases. Like I'm always replacing the creatine that I lose through movement. So that's what I wanted to say about creatine. So I think that you can probably saturate the myocyte over the course of a 28-day or so period, or you can load it up in a week by taking about 20 grams per day. I think that's, I think either of those are wonderful. What I will say, for example, and of course there's always an exception. Today for me is also an exception. So today is, when I'm recording this, is a cardio day for me. So I've just spent, the last 3 days we're training. Today I'm taking a bit of a recovery day. And I don't know what I was thinking this morning, but I got on my bike and I was like, you know what I'm going to do? I'm going to do an FTP, which is, basically it's your functional threshold. So it's testing how long you can hold a certain output, like a certain tension on the bike at a certain wattage. So a certain amount of resistance, let's say. And I just about died today. So so I did legs yesterday. So my legs are, kind of tired and fatigued and stuff. And I think my watts were 233. So I was punching out like 233 watts. And I was able to maintain it for about 22 minutes. And you better believe that even though I didn't train today, I marched my butt after that cardio workout upstairs, made myself a protein shake, and gave myself some creatine because my legs were just dead. They were just dead. So there are days where I am super on it. Like today, I had this, kind of really difficult bike workout and remember to take the creatine, but it doesn't always happen. Okay. Question about Ozempic. Gosh, why is Ozempic all the rage? That was a question. And I'll say that there's a lot of, it's so interesting. People can become so polarized about something like Ozempic. And I think that Ozempic is basically a semaglutide, right? So it mimics the action. So it's called a GLP-1 receptor agonist. So all those big words basically just means that it mimics the action of GLP-1. And all you need to know about GLP-1 is that it helps to increase insulin secretion. So it increases your natural insulin secretion. And when we increase our insulin secretion, what happens? We get increased blood sugar disposal, right? So we are taking the blood sugar out of the plasma, we're taking it out of the blood, and we're dumping it into the cells. So it's going to improve glycemic control. So you're going to see better blood sugar markers with it. It also makes you less hungry, right? It reduces your appetite. It makes you feel fuller longer. Side effects may include nausea, vomiting, diarrhea, abdominal pain, constipation, loss of muscle mass. It's like one of those commercials, like side effects may include death. So where I think we go wrong with medications like this is I do think that it's a useful tool for an obese patient, for a patient who is a victim of the system, really. Let's just call it what it is. Someone who is a type 2 diabetic, someone who has cardiovascular disease. These are largely lifestyle diseases, right? So this is where, we may see someone overconsume calories over a very long delta. Typically, it's processed foods, and it's not necessarily the processed foods that are causing the weight gain, but it is the lack of satiety and the over-consuming, the increased caloric ingestion of the foods, of course, that are causing the weight gain. So it's like that KICO, right? It's like calories in versus calories out, or CICO, depending on how we're pronouncing the C in CICO, KICO or CICO. So someone who's fallen to the system, that's how I would like to say, can really benefit from this. So someone who's obese or morbidly obese, who has dysregulated dopamine responses to food, who may have a history of trauma. There's other things that are sort of contributing to the obesity. Maybe they're on other medications that are also driving up obesity. I do think that this medication can be useful. Where I think we're going wrong is where we see celebrities who have all the access in the world to chefs and trainers and stress management techniques, where they are using the drug to drop weight quickly. And they pair that with their own caloric restriction, let's say, and fitness. And they do it maybe for press, for attention, or whatever. I call them, garbage rags that you sort of see in the nail salon or whatever when you're checking out at the grocery store. Every sort of raggy magazine always wants to feature someone who's dropped so much weight, the before and the after, right? So a lot of celebrities, unfortunately, kind of know that if they want to get some attention, maybe there's a movie coming out or there's something they want to promote, or they're just trying to stay relevant, are getting on this drug and, trying to take a piece of the attention pie, we'll say. And I think when you've been in the healthcare field as long as I am, you start to see patterns emerge over and over again. And once you see the pattern enough times, you can sort of recognize it when it's starting. So here's kind of what it looks like. And Ozempic fits all of these. So there's this new miracle drug cure-all, right? Then we see the pharma marketing machine sends drop dead gorgeous pharma reps to doctors' offices who flirt, who make them feel special. They're taken out for steak dinners. They're given bonuses for prescription behaviors, which can and absolutely do influence their behavior, the way that they are scripting out these drugs. The drug is given en masse to the population, right? Because we have these doctors that are being influenced consciously or unconsciously through incentives, and it's given out en masse, and then we start to see side effects. Raise your hand if that sounds like something that we saw in the last couple of years. I think that you see that pattern enough times, like miracle drug, no side effects. And then you see the reports and it's like redacted, redacted, redacted. And then, of course, once it's out en masse to the population, we see the side effects. Unfortunately, we see the side effects. And then it's usually not corrected until like 10, 20, sometimes more years after the fact. So that's my thoughts on Ozempic. I think it's useful, and I think that we need to proceed with caution. And if there's one thing that I can do for you, my listeners, my dear listeners who I love so much, is that I can teach you how to think critically and maybe suss out some patterns that may not be inherently obvious to you because you haven't been in practice or whatever the reason is for however many years, but for you to think critically for yourself and for you to advocate for yourself. That would be how I would, if there's anything that I can ever do for you, that's what I would want. That's what I would want for you to take out of this podcast. Okay, so let's talk about estrogen. So I had a question come in about estrogen dominance and reduced blood flow during her period. So she asked, I have this reduced blood flow during my period. Is it estrogen? And what happens when I receive questions like this? So just so you ladies, so everyone who's listening, just so you know what happens to my brain when I hear a question like this. So I have reduced blood flow during my period. Is it estrogen? That was the question. My brain basically explodes with questions, like fast and furious. I can't stop them. So, because I always want more color. I will always want more detail. So in my mind, it's like, okay, so we know that menstrual periods usually, consist of something like 2 to 3 tablespoons of blood, like 40 mils-ish of blood. So when you say lighter period, so I have a, lighter blood flow, right? Lighter blood flow during my period. Does that mean a period that's shorter in duration than usual for you? Does that mean that you're changing your pad or your tampon less than usual? Is it that you don't have that heavy flow at the initial onset of bleeding for like that first day or two, but then you have a consistent light flow for the rest of it? Is it like bleeding that resembles spotting? So this is what happens in my brain. So I'm going to try to answer this question with all of those parameters in place. Okay. So first of all, women who have been bleeding for a while, you'll notice that as we are, well, first I'll say that period flow can vary, right? It'll vary through through your lifetime. So usually when we first start bleeding, like when we're teenagers, it usually can be a little spotty, right? It's usually quite light. It's usually bright pink. And then we get sometimes we can get a little dysregulated, age 16, 17, 18, the period can kind of look, the woman can, I'll say young woman at this point, when she's 16, 17, it can kind of look a little like PCOS-y, if that's a word. You might have a few skip periods, a few anovulatory periods. And so periods typically, in terms of flow, become more regular when you're in your 20s and 30s. And I would even add on to that, even more regular after you've had a baby. I have always, and I've shared this with you in my book and shared this with you on the podcast, always have had kind of terrible periods, but there are a couple of points in my life where it really did improve. So one was immediately following the birth of my children. And then there were many other stressful things that sort of came after the birth of my children. My clinic burned down. I went through a divorce, and my periods went from better to just insanely bad. And then going on vacation, as if any of you've read the book, The Betty Body, you'll know that my trip to Italy was sort of my, it was my aha moment where I was actually having a great period, even though I was kind of at a really low point in my life. So periods tend to become more regular, 20s and 30s. And then I'll say after pregnancy as well. But when we are moving into our late 30s and 40s, so by that time, most of us, if we are thinking about having children, have probably had our kids in our 40s, although there are certainly exceptions to that as well. But many women will notice that in their late 30s and 40s that we are going to potentially start developing heavier periods because of progesterone dropping and estrogen is kind of running dominant in the luteal phase of the cycle. And then they will move into they can often become lighter and maybe more irregular through the perimenopausal years. Okay. So all that to say that age is a huge factor in the strength, we'll say, of your bleed. I mentioned it before, but when I was talking about PCOS, but a lack of ovulation sometimes will also, well, not sometimes, always will contribute to lighter periods because, you're not releasing an egg. So when you're anovulatory, this can lead to either absent periods or very, very light periods as well. And then I, mentioned POI, primary ovarian insufficiency. This is when a woman's ovaries stop functioning properly before menopause. That can also cause scant and light periods as well. So a lack of ovulation is another reason why you might see light periods. Body weight changes. Okay, so if you are underweight or you have lost a large amount of weight in a short period of time, you will also see your period affected with that. So your periods may become very light or they may stop altogether. I experienced this when I was competing in figure. I lost my period. It was probably like 3 or 4 months even after the show because I had such low body weight and really messed up my period for my entire cycle, really, for quite a long time. So when your body fat level is too low, that will stop ovulation. Women, we just need a little extra padding, like you gotta give the boys something to hold on to. So we need a little extra fat. We hold a little bit more extra adipose tissue than our male counterparts do. So that's one thing, and of course that encapsulates eating disorders as well, right? So if you are underweight or you are overly restricting your calories for a long period of time, you'll lose your period. We often, even in the competitive world, when I was talking about figure, bikini is also the same. About half of the women in that world don't have regular menstrual cycles. They are not bleeding every single month. That could be because of exogenous hormones that they're taking, but also because their body fat is just too low. The other thing can be too much exercise. So if you are overdoing it, my cardio bunnies, even you can overtrain, you can probably overdo it on the weights as well. So if you're not recovering properly and you're doing too much exercise, that can also lead to changes in your period. The other thing that can give you light periods, I know this is like, thanks, Captain Obvious, but pregnancy, right? It's like, all right, Captain Obvious with the pregnancy comment, but yeah, during pregnancy, your period should stop. But the reason why I'm bringing up pregnancy is implantation bleeding usually happens. So the egg is fertilized in and around ovulation, right? So you release the egg. If you're trying to get pregnant or the sperm meets the egg and it's fertilized, the egg now is going to implant into the lining of the uterus somewhere around a week to 2 weeks after you ovulate. Well, that coincides with when you probably should be getting your period, right? So if you release the egg at ovulation, that's about week 2 of your cycle, your implantation bleeding, which is like kind of spotting, is happening when the egg is attaching to the uterine lining, as I mentioned. So it may seem like a light period, but what's actually happening is you're pregnant and you've just experienced some implantation bleeding. So wanted to just make sure that if you think you might be pregnant, if you're planning on getting pregnant and you had a really light period, it might not be a period, it might be implantation bleeding. And of course, stress. Always, I would recommend going and listening to my perimenopausal masterclass on stress. Part 1, I talk for a significant amount of time on the show about the effect that stress can have on the body's hormones, which can interrupt the regular menstrual cycle and the propagation of ovulation and all of that. So stress management is absolutely paramount for a proper flow, proper bleed week, if you will. Now, there are more questions about perimenopause. So again, I'm gonna answer some of the questions were, when does it start? How to prepare for it? What are the early signs of perimenopause? So I will say that I covered this in the perimenopausal masterclass, but just for review, because we don't all learn immediately when we hear something for the first time, the classic definition of perimenopause is at some point, so specific, right? At some point in your mid-30s, you're going to start to notice persistent and consistent changes in your hormones, namely progesterone. Okay, so we will start to see progesterone starting to decline. And when we are thinking about symptoms of low progesterone, it might be difficulty getting or staying pregnant, breakthrough bleeding, like we were mentioning, or spotting during the second half of the menstrual cycle, symptoms of PMS, so particularly the emotional symptoms of PMS being heightened. So progesterone really acts to lull the brain to sleep. It does that through activating GABA neurotransmitters, which is an inhibitory neurotransmitter in the brain. And it basically just rocks the brain to sleep, all the fear and anxiety centers, and sort of lulls the brain into sort of a blissful state. So if you are finding that you have more fear, more anxiety, difficulty sleeping at night, and you're in your 40s, it may be due to the you might have low progesterone. So you should definitely be getting that tested. Other symptoms of low progesterone would be having migraines right before, or like really bad headaches right before bleed week. So kind of in the 2 to 3 days right before you're bleeding. We call these menstrual migraines. Very heavy menstrual flow. So this is like unopposed estrogen, like estrogen's going unchecked in that luteal phase of the cycle. Anxiety, as I mentioned, swollen, painful breasts as well. Again, this is largely because progesterone kind of keeps estrogen in check. And when we have low progesterone, estrogen is stimulating proliferation in the cells of the breast. It's causing, cell reproduction, which we don't want always with the breast, as you might imagine. When we think about symptoms of perimenopause, they can be, they can be hot flashes, can be bad sleep. Those are sort of the big ones, but they can also be more subtle. Like there's also signs of perimenopause that are not just hot flashes. So, back pain and neck pain that you never had before, joint pain, stiffness, right? Difficulty concentrating, being more anxious, weight gain despite, isocalorically, like you're still consuming the same calories that you always have, right? Feeling more angry or like the world is against you, right? Not wanting to dress up or not wanting to see your friends. Your ambition waning, like you just feeling like, gosh, I just can't push this hard anymore. Not wanting to be snuggled, not wanting to be touched, having no libido, thinning hair, brittle nails. Like these are all more subtle, like not more obvious signs of perimenopause, but they are usually, all diseases exist on a continuum. And this is sort of I'll call those like entry points potentially. So a lot of the things that we talk about on the show, diet and training and stress management, are really going to help with some of those things, and sometimes getting uncomfortable. Like when you don't want to dress up or socialize or see your friends, making sure that you dress up and socialize and see your friends. Every single time I do that, because I can kind of run a little introverted. So sometimes I'll be like, I won't reach out, or I won't make plans, or I'll cancel the plans, or whatever it is. I always feel better after I've seen people, always. And so sometimes it means parenting yourself in a way where knowing that there's people that really love you and really value time with you, and making sure that you prioritize time with them as well. All right. Do I still intermittent fast? I do. So I do intermittent fast still. I still think that it is a great way to control calories. I still think that it's a great way to improve autophagy, although it's a very hard metric to even, sort of quantify. But my fasting these days is pretty gentle. So I probably fast, 12 to maybe on the upper end, 14 hours a day, like nothing really more than that, which means that my eating window is probably 10 to 12 hours, which is, good chunk of the day. So most of my fasting is while I'm sleeping. So I sleep for 8 to 9 hours every night. That's what I love to do, depending on where I am in my cycle. If I'm about to bleed, I like to sleep more. When I am bleeding and in my sort of pre-ovulatory, before I ovulate, I don't need as much sleep. But in the luteal phase, I certainly need a bit more. What I have found over the past several years, I used to be the girl that would delay eating until noon, and then I would sort of eat all of my calories between, call it 12 p.m. and 8 p.m. I have really had a stark phasic shift in when I start eating and when I end eating. So I usually start eating right around my workout. So in that peri-workout area again, so right before or I'm putting a protein scoop in my water. So during, and then after my protein and my carbs afterwards. And that's probably happening at somewhere around 7 a.m. So I'm usually at the gym, depending on the night before, I'm probably getting home at about 7:15, and I'm eating at that time. And then I finish eating in the afternoon with the boys. So, my boys get home, we have dinner at 5 o'clock, and partially that's because I need to fuel my kids for their, for all of the sports that they do and their after school activities. They will usually come home from sport and eat again at 8 or 9, sometimes 9:30 in the evening. But we have sort of one dinner, and my kids, because they're, still growing, they're still anabolic, they will have two dinners. So I usually stop eating at about 5. And then if they're eating, let's say at 8 or 9 o'clock, of course, I'll sit with them and we'll chat, and I'll have some water or some tea or something. But the whole point with intermittent fasting is I think it's a useful tool. I think it's a great tool for daily use. I just make it so easy that I don't even think about it. And so that's probably why many of you have noticed that I don't really talk about fasting that much anymore, because I feel like it's a habit that I do almost always, but it's so gentle that I barely notice it. So if I'm eating from like 7 to 5 or 7 to 6 or, whatever it is, how many hours is that? 7 to 5 is going to be 10 hours of eating. If I'm eating 7 to 6, that's 11 hours. 7 to 7 is 12 hours. I just kind of do it and I don't really think about it. And I think that if you can make most of your health habits that easy, the likelihood of you adhering to them over time is going to be so much better, because it just becomes automatic. All right. So let's talk about seed cycling. This was a great question that came up, and I wanted to make sure to answer this one as well. I'm going to be super honest with you guys. Okay. So I know that seed cycling exists. I know that there's lots of people that swear by it. I am never going to discount a woman's story. If a woman says to me, having sesame and flax seeds have saved my period, have saved my menstrual cycle, my answer is going to be, then continue doing it. I'm pre-framing that because first, I never remember which seeds go where in the cycle. So seed cycling basically is that you're supposed to have certain seeds in the follicular phase or the first 2 weeks, and then other seeds in the luteal phase. I never remember which one goes where. Okay. So I think that the premise is that the phytoestrogens, let's say in something like flax seeds, can help increase or decrease estrogen levels as needed. And certainly phytoestrogens, just as a quick reminder, are compounds, plant compounds that basically mimic the action of estrogen. They can occupy the estrogen receptors as well. There's also things like zinc and selenium from some of these seeds that you can take to help with promoting progesterone production, right? So when we look at something like pumpkin seeds, which I believe is in seed cycling, zinc from pumpkin seeds, it's claimed also to promote progesterone production for the preparation of the luteal phase. Okay. And then there's also the polyphenols, which are supposed to inhibit estrogen levels from increasing too much, vitamin E, again, for progesterone levels. And that's all fabulous. I guess my only comment is that there's a lot of other sources of, let's say, zinc. So if we think about pumpkin seeds, really great source of zinc. So do oysters, right? So I will personally, I'll have oysters every day of the week. I love oysters. So I will always have oysters, or I'll have Brazil nuts. I guess, is that seed cycling with those? No, because they're nuts. We're just talking about seeds. So Brazil nuts also, when we talk about selenium, heavyweight champ, right? They are the undisputed heavyweight champ, Macho Man Randy Savage. There's my reference, my little Easter egg reference for those of you that used to watch it when it was called the WWF. It is, kind of the heavyweight champ, right? So much selenium in Brazil nuts. So my point here is that you certainly can seed cycle. I am just kind of naturally in my diet usually putting some kind of seed, like if I have cottage cheese or Greek yogurt, which I like to have as a snack, because it's super high in protein. I will also usually have, it's like chia or flax. I have pumpkin. seeds. I also like to put pistachios, which is not technically a seed, but it's one of my favorite nuts. So I'll put that on my Greek yogurt, or I'll put it in my cottage cheese for a little texture and a little crunch. But there are other foods other than these kind of particular seeds that can help with some of the proposed, the proposed efforts, if you will, of seed cycling. So I'm not against it. I just think that I don't know how much evidence there is in the literature to say that it's only the seed cycling. Like there's something inherent to the seeds that can help that. So I think that they're great. I think that you can and should try it. And if it works for you, then you do you, boo. Like if it works for you, I'm all in, like Flynn. Like I want you to do it. But it's, keeping in mind there's so much bio-individuality. You're only really going to know if you try. And also know that the phytoestrogens, the zinc, the selenium, the vitamin E, there's also a lot of other rich sources in whole food products that can also help to facilitate a normal menstrual cycle. So that's where I stand, I guess, on seed cycling. I guess I could qualify my position as neutral. So it's like, yes, they can work. And there are other sources that can also do the job just as well. I think there was a question about mobility workouts. And I did want to touch on this for a moment because as a chiropractor who's been trained as a chiropractor, who has a pretty, I feel blessed education on human movement, I think that mobility is often the forgotten vertical. So, and I'm guilty of it too. So we talk on the show a lot about nutrition. We talk a lot about fitness and exercise and squats and deads and, all the things, hip thrusters, all the things. There's not a lot of discussion about mobility and proprioception and stability. And I saw it in practice for almost 20 years when I had someone come in with an injury. Let's say they injured themselves at CrossFit, they injured themselves, they injured themselves in a car accident. It didn't matter how they injured themselves. There would be the care that I would provide in the clinic. So it would be often the adjustment. There would be muscle work. There might be, we had a rehab center. So I would go and give them rehab exercises, and they would do the exercises in the clinic at the end of their adjustment. But then that would be they wouldn't go and they wouldn't do it again until they came back into the clinic, which is why I often had patients in the clinic 2, 3, sometimes depending on the severity, 4 times a week, because I knew that the only time that they were going to do their rehab was after their adjustment. And so I would say that mobility is a vertical of fitness and human movement that is often underlooked. I will say that most progress, or maybe more accurately, lack of progress in the gym is because you are not working on your mobility. It is because you are not working on your proprioception and stability, which is 2 words that are kind of like interchange, like proprioception and stability is kind of talking about the same thing. So an example of that might be if you, for example, are doing an overhead press. So this is where you might be doing a shoulder press. You're holding 2 dumbbells in your hand. Your elbows are flexed at 90 degrees. And then what you're trying to do, if you're watching me on YouTube, you'll kind of get a visual here. But if you're trying to extend the arm up, then that's what we call an overhead press, a dumbbell overhead press. If you notice when you're progressing, you're applying the principles of, let's say, progressive overload, and you're noticing that on heavier weights, one arm is able to get up and the other one is struggling, that's a stability issue, usually in the scapula. So it might be a teres major, minor, infra, or supraspinatus issue where you're not able to stick the scapula onto the back of the rib cage. So that could be subscapularis as well, which is a muscle that's kind of underneath the scapula. So without kind of going too far down this super nerdy conversation, this is where I get kind of turned on. I'm not going to lie, but this is where, so if you're noticing when you're pressing up that your right side, you're always able to get up, I don't know, let's say you're doing 30 pounds or something, but on the left side, you're struggling, or it gets up slower, you're not able to contract as fast. It's a stability issue. So mobility is something that everybody overlooks. And if you are consistently getting injured in the gym, like let's say, and I did this for years, even as a freaking chiropractor. Okay. So I would approach my PR on the squat. So I would approach my PR is like on the squat is 185. So I would get up to 185 pounds on the squat, and without fail, I'd put I'd kind of do my warm ups, and I would do just like a little bit of a warm up, but not really working on ankle mobility, not really working on hip mobility, because I have such a strong back. I was like, well, I have all the spinal flexion and all the spinal movement in the world. I don't need to work on my ankle mobs, whatevs. And without fail, I would hurt my knee. Without fail, I would tweak it at 185 pounds. And then what do I have to do? Well, I have to go back and I have to drop the weight, and then I have to work back up to 180. So I was just like a hamster on a hamster wheel, going down to 135, working my way back up to 185, injuring myself again, and then doing it again, like an insane person. Okay. So what has become something that I used to get frustrated with my patients and in myself has become something that I do all the time. So always before a leg day, there's always ankle mobility. There's always hip mobility. So I'm always trying to open up the hips. I'm always trying to improve my ankle mobility, my dorsiflexion, my ability basically to approximate my foot to my tibia. I have been adjusted, as a chiropractic student and as a chiropractor for the better part of, I guess it'll be over 20 years now. So I have a very strong back. I never have any issues there. I'm very flexible with my back, certainly hold tension in certain areas. I have sort of a pattern that I hold tension in. But for me, I need to focus on hip and ankle mobs, right? So always before a leg day, I'm always working on opening up the adductors. And I will actually, depending on my mobility warm-up, that will determine how much weight I'm putting on the bar. So I might have slept badly the night before. I don't know, kids or something, husband, something, like whatever it is in my life. Depending on how my mob warm-up goes, that's kind of what determines the bar, like how much I'm squatting that day. For my shoulders, it's lots of like windmill type movements. So basically the humerus kind of twisting and turning, if you will, in the glenohumeral joint, right? Or I'll do a lot of scapular articulation, something that's called pales and rails. This is, I was taught this by one of the, it's called functional range conditioning that I took classes on several years ago. But pales and rails are basically teaching the central nervous system how to control and function in all ranges of motion, right? And the founder, Dr. Dr. Spina, great name for a chiropractor, by the way, always talks about control, always talks about how to control it. And one of the things that I think is important, even from a weightlifting perspective, is that when you're thinking about weightlifting, you control the weight. The weight does not control you. And that means that you should be able to freeze at any point in your range of motion in your, let's say your squat. We're talking about squat. So you're doing a squat. I should be able to say freeze, and you should be able to freeze and hold that position. If you don't have control over your range of motion, you're doing too much, like you're lifting too much weight. And, I talk about this with my doctors and my health coaches that in our private mastermind, but, this is where the ego is the enemy in the gym, because we all want the big weights, right? We all want the PRs. We all want to, I always like, I want to squat the equivalent of a baby elephant. Like I want to have big squats. Like I want to, I like my big squats, and I cannot lie. I want to have those numbers, and I want to do it with full range of motion. I want to get my ass to the grass. I want my hip and my ankle mobility perfect. And I was talking about this with my friend, actually the day before I got married, at one of the events. I was talking with my friend Connor, and I was saying to him, one of the things that I've come to realize about progressive overload is 10 perfect reps, like perfect reps. So perfect placement, perfect range of motion, perfect descent and ascent, right? So perfect concentric and eccentric. That's also progressive overload, right? If you can punch out 10 pristine reps, that's better than 6 great ones, and then you struggled for the rest of them, right? So that's where I stand on mobility workouts. They're extremely important. Really, really, I think that they should be really essential for anyone before they start working out. I know if you're going to a gym, it's like, oh my God, I got to get the squat rack. So you sort of run to your position and then just start. But having some kind of mob workout, really, really helpful for progression, developing stability, and being able to control your center of mass, I think is super important. All right, so let's leave on that nerdy note. I hope that you found this AMA really helpful. We're going to do this AMA bit, if you will, about once a month. So I'm going to be, for now, I think the easiest way to do it is polling on Instagram. If you have different suggestions, please let me know. But I am going to be asking for your input. What do you want me to be talking about on the show? And based on what you tell me, I'm going to create content like I did today for you. So please let me know if you loved today's episode, didn't love today's episode, what you'd like to see more of, what you'd like to see less of. And we'll talk to you very, very soon.